Hey everyone, what we want to talk about today is dissolving filler. Did you get filler in your lips? You don't love it? Well, good news for you. You can actually make it go away. Now, in today's society, anyone can take a weekend course from a nurse to a PA to a doctor to your OB and start injecting filler. Getting filler in is easy. Getting it out, not so much. That's when it comes to the experts to teach you about how to do it. So in this video, I'm going to give you some tips, tricks, and secrets and a breakdown of everything you need to know about dissolving filler. So first of all, what is filler? Filler is something made out of a synthetic hyaluronic acid that is a substance that's naturally available in our bodies, but we can synthesize it in the labs and have it re-injected to add some volume. Over time, our body eats it up in its own natural ways using an enzyme called hyaluronidase. Now that enzyme is something we can actually make and inject in to dissolve it right then and right there. Common areas to get filler injected are the under eyes, the lips, the cheeks, the folds, and any other wrinkles from the neck up. So why would you want to get it dissolved? First of all, the most common reason is simply because you decided that the filler wasn't placed right or filler is just not for you. In that case, this medication is perfect. There's other circumstances particularly with a particular type of filler called the Vicross line of Juvederm fillers, Velour, Volbella, and Voluma, where you can get a nodule from your filler that shows up 6 months after you got the filler. In these cases, you need this medication in order to get this lump to go away. Second of all, sometimes the filler can be placed wrong and cause a lump itself from the very beginning, and this would be another time to get rid of it. Next, you have something called the Tyndall effect. When you place it under the eyes, if it's placed too superficially, particularly if it's the wrong filler, the filler can look blue, and that would be a reason to get the crap dissolved. Last but not least is the scary thing that nobody likes to talk about. Sometimes the filler can actually be injected into an artery, and this can cause a dangerous and potentially very, very risky complication called vascular compromise. When the filler goes into the artery, it stops all blood flow, and whatever that artery is supplying, usually your skin and hopefully not your eyes, will die. If we immediately recognize this and inject, it can help solve the problem. Now, if it's a day or so later, you still want to have it injected and dissolved, but it's obviously not ideal. Now, let's talk a little bit about some secrets about dissolving filler. So there's about 4 or 5 different types. There's Hylenex, Widex, Widase, and a whole bunch of other ones. I prefer Hylenex. Hylenex is the only one of these that is made from human recombinants as opposed to cows or sheep. The other thing to look out for, number one, this is expensive for the injector to have in their office. The majority of injectors have it in there for emergency for vascular compromise. Luckily, that doesn't happen very often, but people either forget or think it's okay to have expired product. Once this expires, it stops working. So make sure it has not expired. Now, while the brand is important, it doesn't really matter. Getting it injected is more important than anything. The second most important thing after the fact that it's not expired is making sure the right amount is injected. When you go to your filler training course put on by the company that's selling the fillers, these people who are learning over the weekend do not get any training in how to dissolve the filler in that course. Now, there's many studies, one in particular by Dr. Vartanian, that identified how much you need. When it comes down to it, it's going to vary by experience. We have a lot of patients who come to us to get their filler dissolved that was done elsewhere, and because of that, I have experience, and I have my particular formulas based on how much filler and what type of filler you previously had done, how long ago it was injected, and where it was injected. I use that scales to determine how much to inject. Now, there is a such thing as injecting too much. You can't take a whole vial and get it all gone because you don't want to dissolve the natural hyaluronidase in our tissues. Go low and steady and need to do it a couple of times to get it dissolved exactly. Only you, the patient, will know what it looked like at baseline. It's hard for any practitioner to know when your lips are full what it looked like before, whether you show us pictures or not. So we're just going to where we guess to where it's back to what it was before, and you got to tell us that. When it comes down to it, make sure you're always going to someone who knows how to fix their own problems. Make sure you check the expirations and make sure they're injecting the right amount before they do it. If you don't like the filler, my suggestion is go back to your injector, tell them you don't like it, and ask them if they can kindly dissolve it. They shouldn't be charging you to do that if it's something that caused lumps or nodules, but the rest is up to you. If you have any questions, feel free to reach out to our office and we can get back to you. Take care.
Bring that funky music now.